Hello everyone, welcome here. I'm Dr. Jane Wanjiku. Today I'd like us to talk about HIV prevention. And I'll introduce by saying HIV is a viral infection which once contracted requires you to take drugs for your entire life. And sometimes there are some opportunistic infections that will come when one is HIV positive and when they don't take the recommended ARVs, which can make life quite expensive or unbearable. So today I'd like us to talk about HIV prevention for the people who are exposed and the people who are not exposed, so that we can spare ourselves the risk of contracting HIV virus. And we shall start by looking at the prevention before exposure, that is the pre-exposure. And the regimens that we use for this is the pre-exposure prophylaxis, that is the PrEP. So the persons who are eligible to get the PrEP regimen are HIV negative individuals who have an ongoing substantial risk of contracting the HIV virus. However, for you to receive the PrEP, you have to meet three standards. The first one, you have to go through the lab and confirm that you're HIV negative. Secondly, you should not have any contraindication to TDF, one of the drugs that consists of the PrEP. And those contraindications include severe renal disease, severe kidney disease, or having a weight of less than 30 kgs. The third standard is you as a client must be ready to take the PrEP. Because I understand there are some people who could be having an ongoing substantial risk, but they are not yet ready to start their preventive therapy. Yes, so the PrEP consists of two drugs, TDF and PMTCT, or another alternative is TDF 3TC, that is lamivudine, for the adults above 30 kgs. So it can be taken in two forms. There is the daily oral PrEP, where the exposed person, where this client who is not yet HIV negative, but they are continuously exposed, they want to prevent themselves. They should take this tablet daily for as long as they are exposed. However, it doesn't start to work immediately. Once you start taking the tablets today, it will start preventing you 7 days later. So as long as you will be exposed sexually within those 7 days, you will have to use the barrier methods of prevention like the male and female condoms. Another form of taking the PrEP is the event-driven PrEP, where there is an isolated expected sexual act, and I mean once isolated. And I should give a disclaimer here that this should not be abused to misbehave. But if there is an isolated expected sexual act, then this person will take the PrEP. This is the TDF emtricitabine. They'll take 2 tablets of this drug 2 to 24 hours before the act. Then take another 1 tablet 24 hours after the first 2 tablets, and then take another fourth pill 24 hours after the third pill. And this, if taken this way, is deemed to prevent them from contracting the virus if the person they engaged with was HIV positive. Then there is the third option for the sexually active women, that is the depirivine vaginal ring, which actually is inserted into the vagina. It is a silicone flexible ring that usually releases the dapirivine. Dapirivine is an antiretroviral drug. It releases the drug slowly into the vagina over a 1 month period. So once it's started, it should be changed after 1 month. In that entire month, it will prevent this woman from contracting the HIV virus. However, this has been recently approved in Kenya and some other African countries, including South Africa, Zimbabwe, Lesotho, and Uganda. It's still on pilot study, so it's not available across the country, but in some counties, it's available. Then we will talk about prevention of HIV in the already exposed client, that is post-exposure, that is a PEP. And we consider one eligible to get the the post-exposure prophylaxis once you have been you have had an high risk exposure incidents like penetrative sexual intercourse with someone who have denied to get tested and know their status, and you suspect they could be HIV positive. Another high risk is for healthcare providers in the case of a needle prick when you are attending a patient who is confirmed to be HIV positive or who have not voluntarily taken their HIV test. So these, for the post-exposure prophylaxis, the PEP, should be taken as soon as possible after the incident. That is within 72 hours. And the regimen to be taken under these: for the adults and adolescents above 30 kgs is a TDF 3TC DTG, a three molecules regimen. For babies below 15 years and below 30 kgs of weight, they should take the ABC 3TC DTG. These regimens should be taken for 28 days continuously at the same time of the day without skipping. Then after this regimen, the client should follow up with a test, at least 2 consecutive tests to confirm their status. However, this regimen is confirmed to prevent contraction of the virus even if the other person was HIV positive, as long as it's taken as prescribed. The other incidents we are going to talk about prevention of HIV is in pregnant and breastfeeding mothers. This is what we call the prevention of mother-to-child transmission of HIV virus. We recommend that all pregnant mothers should go through the ANC antenatal clinic and should be cancelled and be tested for HIV. And in this case, they are tested for HIV alongside syphilis and hepatitis B virus, because this can be really deleterious to the unborn baby. So this test should be taken at the first antenatal visit, antenatal clinic visit, or at the first contact with this pregnant mother. And if this mother turns HIV positive, they should be started on the antiretroviral therapy immediately, as soon as possible, ideally immediately, and if not, maybe within 2 weeks after the diagnosis. And this is aimed at reducing their viral load, the HIV viral load, to prevent them uh, from transmitting the virus to the unborn baby. And now, after the delivery, we should be preventing this baby still, because this baby will be breastfeeding. We recommend that the baby born by a HIV positive mother should be breastfed as usual, including of the first 6 months of exclusive breastfeeding and introduction of the complementary food at the 6 months, like any other baby. So at this time, remember the baby is exposed. So we will be preventing this baby from contracting the virus. At birth, we will introduce two drugs, that is zidovudine and nevirapine, which this baby should take from 0 to 6 weeks. Then after 6 weeks, we drop the zidovudine, the baby will take nevirapine, and we will add cotrimoxazole suspension, which the baby will take as long as they are being breastfed. And this regimen should be stopped